The relationship with the clinician is the most important thing in my care. There's nothing more important. And so I think I could look at any data, I could go to any medical center and they might be doing the same protocol. So the care I receive might be the same. But for me, that relationship is the most important thing. And it's huge, I think, for someone like me who really likes to feel like they're managing a situation, that really likes to be in control, to trust someone enough to give up some of that and to really say, like, I am putting my life in your hands. And I've actually had the conversation with my clinician and said, I don't know if you realize how hard this is for me to do, but I need to be able to hand this over to you and feel okay with that. And for her to say, from the cancer treatment perspective, I got this, you go out and live your life. And that, to me, if we didn't have a relationship, I wouldn't have as much confidence in her managing the treatment for me. And I think I need to be able to go into an appointment and ask lots of questions and not feel judged or not feel like she thinks I'm trying to second guess her clinical decisions. But for her to know me as a person is really vital for me. And I think when an appointment starts and the first thing she asks is, what are your kids doing for spring break? And that's what's front of mind for me. What's front of mind for me is not sitting in the infusion chair for the next 3 hours, or that this is treatment number 30 and this ties to this clinical study. The most important thing for me is, am I going to be well enough to have a great spring break with my kids? And so for her to understand me and my goals and have that conversation, in the absence of a relationship, that wouldn't be happening. And I think I would be less motivated in my own care if she didn't have that relationship with me.